Hello, Dave Bauder here from the Weight Loss and Vitality. We're going to go ahead and talk real quickly about vitamin D deficiency and do a brief overview, about a 3-minute long video, and see if we can answer some questions for some people out there. Vitamin D2 is a fat-soluble prohormone. What does that mean? Well, vitamins are either fat or water-soluble. This is very important to understand as it determines how each vitamin is absorbed, utilized, and stored in the body. Since vitamin D2 is fat-soluble, it is absorbed better when taken with healthy fatty acids in the gut and then stored in the body fat where it is dissolved and utilized. The prohormone component of vitamin D means that it contributes to the endocrine or hormone system of the body in multiple ways once it is absorbed and processed in your body. As you can see, vitamin D comes in D2 and D3 form. The main difference is the bioavailability of either of these for the body to process and use. D3 is considered superior over D2 for supplementation, although D2 is still regularly prescribed in commonly primary care settings. Sources of vitamin D comes in multiple forms. Most people know that vitamin D is made with the help of the sun, but how much? Well, it's probably not what you've been told. Simply walking outside for 15 to 20 minutes and letting the sun hit your hand and your face, that's not enough. People need more than that. And that usually requires maximum skin exposure, midday sun. 15 to 20 minutes, usually a day, would be required, but not many of us are doing that. Eating vitamin D foods and taking appropriate supplements can correct most deficiencies. Food, such as fish liver oil and egg yolks, or supplemented foods or supplemented vitamin D foods, dairy and cereal products commonly have that. Vitamin D supplements, oral or injectable, are commonly used. So what are the primary roles of vitamin D and why is it so important? Vitamin D helps with calcium absorption from the GI system, supports healthy parathyroid function and bone formation, muscular strength, immune system support, cancer prevention, particularly colon, prostate, and breast, diabetes prevention, heart health, and helps regulate and support other hormones of the body. Diagnosis is extremely easy with a simple blood test targeting an optimal level around 50. The blood test normally costs around $40. Treatment is centered around D3 oral daily intake. Our clinic also provides injectable forms in patients with GI disturbances. In some of my patients with a history of gastric bypass or other surgery, they do better with injectable D3 secondary to the poor gut absorption. Here are some factors that influence vitamin D levels that we don't normally think about. Poor air quality. That decreases the UVB rays that come through the air. Latitude, with the higher latitudes having less UVB rays. Skin pigmentation. Hyperpigmentation requires more rays to get the same vitamin D production. Body weight. Increased body fat decreases the bioavailability of vitamin D. Age. Aging skin is thin and results in less vitamin D production. And then any chronic gut, liver, or kidney diseases impair the amount of vitamin D that is produced. One thing that we have to mention is that anything in excess is not good, and vitamin D is not the exception. Excess vitamin D is worrisome, and the main consequence of vitamin D excess is toxicity or buildup of the vitamin D, resulting in calcium buildup. That's also commonly called hypercalcemia. This can cause poor appetite, nausea and vomiting, weakness, frequent urination, and kidney problems, resulting in kidney stones. The treatment that we commonly do is just stop the vitamin D supplementation or lower the vitamin D supplementation. This is extremely rare, okay? But we do like to make the association and make sure that it is noted that science has linked hypercalcemia to heart disease and heart attacks. So too much vitamin D can result in too much calcium, and thus there can be a problem with increased calcification, and science has made that correlation that heart disease and heart attacks is a result, can be amplified or can be a result of increased calcium levels in the blood. Vitamin K2 and magnesium should always be considered in all patients when supplementing a vitamin D, because this specifically gets at what we're addressing right here. When considering vitamin K2 and magnesium, we could literally talk for an hour. But I'm going to go ahead and summarize this and stress the importance of adding this into any vitamin D supplementation program. Vitamin K2 is essential for blood clotting formation and the regulation of calcium in the blood, partly because clotting factors require calcium. However, we also know that vitamin K2 plays a critical role in removing calcification from the arteries and maintaining a healthy heart, supporting the immune system, and many other things. The main reason I encourage vitamin K2 is keeping with the idea of lowering the calcium level and prevent the building up or calcification of the arteries inside the body. Magnesium is also very good. Magnesium deficiency is much more widely recognized as previously thought. We know that it supports the relationship of muscles and how it actually relaxes the muscles, keeping in mind that vitamin D actually increases the contraction of muscles and magnesium balances that out, lowering the blood pressure, supporting a heart health, and many other health benefits. I've included a recommended supplemental dosage guide for vitamin K2 and magnesium. My most common starting point for my patients at the Weight Loss and Vitality Clinic is vitamin D3, 5,000 IUs a day, vitamin K2, 120 micrograms per day, and magnesium, 300 milligrams per day. Treatment is always modified based on the patient's conditions, chronic diseases, or any lab findings that we may find. Below on the bottom of this slide, I've included a link to the Mayo Clinic, which actually lists by disease processes, fibromyalgias, different types of endocrine-related conditions, specific vitamin D and recommended dosage guidelines that you might want to check out if you're interested. So that pretty much sums up our vitamin D overview. And here at Weight Loss and Vitality, we offer vitamin D testing to anybody that might be interested in having it done. Real quick, easy, painless. Cost is about $42. We just go ahead and send all our patients to the local draw center, and they have their blood drawn, and then usually within 2 or 3 days they'll have their results back. And that testing is available to pretty much anybody across the United States. So anybody that would like to have that done, just go ahead and reach out to us. And I'm going to, the last slide, the very end of this video, I'll leave some contact information for anybody that might be interested. And if you have any additional comments or questions, feel free to get a hold of us here at the clinic. Thank you. Have a great day.